Good morning, everyone. Welcome to Center of Balance Life. My name is Kenny, the acupuncturist and Chinese medicine practitioner from Center of Balance. Today, I'm going to talk about how to use acupressure points to help relieve dysmenorrhea. Before I start, guys, please drop me a message under the comment or give me a like. And please share this video. Even better if you could tag anyone who will benefit from our daily life free for all DIY acupressure points. So do you know anyone who suffer from dysmenorrhea? If you do, please type 1. As usual, before we start, let's get our tools ready. So what are the 3 tools? Number 1 is our finger. Okay, can be your thumb, can be your index finger. Number 2 is our knuckle. So what happens is you bend your index finger down and you place the thumb just on the nail bed to support it. Okay. Number 3 is a massage device or some small rounded tool, but not sharp. Okay. I have my chopsticks. Any of these 3 tools can be used to locate tender or sensitive points, and you apply pressure for 30 to 60 seconds, and then you move on to the next point. And you repeat this 3 times, 5 times throughout the day. But at least you're doing it every day, please. So what is dysmenorrhea? Dysmenorrhea is the medical term for painful period, and it tends to peak quite soon after puberty. So if your period are getting increasing painful as you get older, you should seek medical attention immediately. Dysmenorrhea can be divided into 2 categories. One is your period pain when your first period or shortly after, and without a non-cause, is known as the primary dysmenorrhea, which is very, very common these days, and it's affecting more than half of all women at any age, but some may find the periods no longer painful after pregnancy or childbirth. And the symptoms can last 1 to 2 days, and they're thought to be caused by the uterine lining produce hormone like substance prostaglandins that cause the muscle of the uterus to contract strongly. When it contracts, it starts causing pain, and which further lead to the reducing of blood flow to the uterus. And then the second type, which is caused by certain reproductive disorders, such as endometriosis, fibroids, or some underlying problems such as the inflammation of fallopian tubes, contraceptive IUD device, are all known as secondary dysmenorrhea. What are the symptoms of the painful period? Obviously, can be quite painful and discomfort, and usually are quite severe for the first day or 2 of period. And then that's pain and cramping in the lower abdomen, which can range from gripping to constant ache, and can even spread to the lower back and legs. So other symptoms can also be related, such as headaches, nausea and vomiting, fainting, constipation or diarrhea, and some digestive problem. Or some may have premenstrual symptoms such as tender breasts, swollen abdomen. what other self-care treatment we can do for dysmenorrhea? As usual, go with our wee bag or a heat bag or hot water bottle, and you just place them on your lower abdomen. Okay, some relaxation or some exercise, acupuncture, and acupressures. Okay, we all know the painful period can ruin your mood, your appetite, your energy, and basically the rest of your day. So what is the alternative ways to deal with all these pains? Acupressure, of course. So you make sure you apply some firm pressure on the sensitive spot for 30 to 60 seconds. Pause for a minute before you repeat the same point again 2 more times. Okay, then you move on to the next point. As one spot I'm showing you today, you might a bit more than just a firm pressure. Okay, so it have to be a little bit harder, but just make sure you don't bruise yourself, please. So you can repeat with this acupressure massage as long as it feels comfortable, okay, or until the pain is subside. You ask for help if the massage is difficult to do it alone, especially dealing with period pain and you just want to lie flat in the bed with a hot water bottle. Don't forget to like and share or tag people that can be benefit from this video. Our number 1 point today is on our palm. Okay, so it's at the end of it here, just above the wrist line. So just above the wrist line on the bone here. Okay, so you start checking and you gotta palpate hard to the bone to look for a tender spot from thumb side all the way to the pinky side. Okay, so just above the wrist, and start palpating for the most painful or most sensitive tender spot. If you hit that sensitive spot and it's gonna be painful, you make sure you rub for 30 to 60 seconds, and you can repeat that after you have a 1 minute break. Number 2 is the use of mirror image theory. Okay, sorry, I have a male model. Period pain is usually, this is our belly button, it's usually here or lower here, just kind of in line with the pelvic, right around here. Okay, so where do we find them? The belly button here, where's the mirror image of it? It's distal away from it. So it's, if you look at the elbow, okay, so they're in line with the belly button. Bottom here, look at where my chopstick cut across. It's on your wrist. See? It's on your wrist. Okay, so and plus the pain is halfway here. What do? You find the elbow crease, you find your wrist, you half it. Okay, so this whole area here, halfway from wrist to your forearm, you want to find the most sensitive points around there. Okay, so just under the wrist, halfway of your forearm. There are 3 meridians there. You got to do all 3 of them. Okay, remember you start all from the wrist down to the halfway of the forearm. So you start from the thumb side. So I try and find my crease, my wrist, halfway. It's here. Okay, so you start from the thumb side, use your finger press and massage to check if any tender spot, and give that sensitive spot for 30 to 60 second massage. Okay, then you move on to the next point and keep checking, keep massaging. Then there's your middle finger. Okay, run your middle finger down just between the 2 tendons here. use your finger, or for me, I use my chopsticks to press and massage. Just check for any tender spot till halfway to your forearm. Okay, give that sensitive spot a massage for 30 to 60 seconds. It can be quite sensitive here though, because there's a nerve here. Okay, you might get pins and needles shooting up. That's okay, don't panic, just remember no heart pressure here. Don't hurt yourself, please. And then you move on to your little finger on the side of the bone, just past the wrist. So on the lateral side of the tendon. Again, use your finger or chopstick, press to check for any tender spot, and give that sensitive spot a 30 to 60 second massage, and then you move on to the next one till halfway. Okay, so remember 3 lines here. Now you move further away to our legs. This time is on the medial end of your leg, which is the inside. Okay, midway between the crease on the knee to the tip of the ankle. Okay, halfway here, and you start palpating on the bone from the ankle up till midway, just then you move to the back of the bone, you start palpating again, and then you move till you finish the halfway, then you move further back just to the side of the Achilles tendon. Again, there are 3 different channels down there. You want to find the most sensitive spot and you massage this for 30 to 60 seconds. Okay, so it's just halfway. You find the tip of your ankle and your knee, you half it, and then you start massaging on the bone here first, and then behind the bone, and then you push further back behind the ankle up, and just all this zone here, you can find the most sensitive spot. Okay, so I forgot to mention the heart pressure is the one on our palm here. Okay, you want to give that a hard press, okay, please don't bruise yourself though, it's too hard. So if you suffer period pain all the time during period, then remember you got to massage all these sensitive points every day. Okay, I'll show you guys 3 areas on the wrist, your forearm, and the inside of your knee. Okay, just halfway. One side can be more tender than the other, but then soon you'll find the pain will gradually reduce, or just no pain on that time of the month suddenly. Okay, all because of your hard work of acupressure every day. Of course, these points might not work for some of you, so don't worry, we are here for you. We always care about you. Though we are in level 3 lockdown, we can still help you with our online consultation. Even if you are outside of New Zealand, don't worry, because as long as you have internet access, we can connect and we can talk. With our online consultation, we will ask you questions to understand what's going on and what's causing the problem and so on. Then we will send you a few short video clips or with step-by-step acupressure points that tailor to your specific condition, and we can also post Chinese herbs to you. So please check out our website www.balancetcm.co.nz, or simply call us or email us info@balancetcm.co.nz to book an appointment. We have 3 clinics in 3 different places: Hamilton, Raglan and Auckland, all in New Zealand. My name is Kenny. That's all from today. If you like or enjoy our daily life, please give us a thumbs up, like and share. Thank you for joining us. Looking forward to seeing you guys again. Love to you all. Stay awesome. Ka kite anō.